this is not good for you, correct?
I don't recall the specific. If that's what's written, I don't remember the specifics of the language.
But they've been having this conversation for the preceding 3 nights, hadn't they?
Okay.
I wouldn't know.
Pursuant to Conrad Murray's statement.
We asked the question, sustained, the partial answer stricken, disregarded. You may be fine.
This was in his statement to the police that night, wasn't it?
If I recall, he was trying to wean off the use of propofol, but that's the extent of my knowledge.
Okay. Now, in the statement, it indicates that Dr. Murray gave him no propofol the night before, correct?
He gave no propofol the night before?
And he had gone all the way this night till about after 10 and hadn't given him any propofol either, correct?
According to Dr. Murray's statement, yes.
And then when Mr. Jackson continued to press it that he wanted some propofol, Dr. Murray gave him some propofol between 10:40 and 10:50. Is that what you read?
That's correct.
Now, how much propofol did he give him?
He gave 25 milligrams of propofol and then started him on a drip.
No, it doesn't say he started him on a drip, does it?
I think it does, yes.
Well, it doesn't.
It doesn't?
No.
Can I look at
Sure.
the report? Sorry. First of all, so I look at page 34, sir, and it says it is both given, he's describing it to Detective Smith. This is not of the night, this is during the interview, and he says, it is given both in IV form, and usually most patients are given a certain amount of drug based on their body weight, and then they can be started on an infusion slow enough to keep them, the levels of plasma up so that they can sleep. So they're insinuating that usually a bolus and called a dose and a infusion is usually given.
But he didn't give a drip that night, though, did he?
Hold on.
Okay.
Then on page 36, he says, how much did you give initially? And he said 25 milligrams. That's initially. If he should have said all I gave was 25 milligrams. He just said initially before. Can I ask you, he was giving an infusion every night according to his testimony. And then here on page 39, when I've given it to him before, he handled it fine. This is the end of 39. He handled it fine, and Detective Smith goes, the same dose? And Dr. Murray corrects him, dose and a drip. This is page 39. And then on page 40, it says here, the highest amount I've given him initially, direct on the IV before, starting a drip on him, would be twice that amount, 50 milligrams. So a drip is basically an infusion because that's a nickname of a drip. Right now we use infusion pumps to infuse propofol. And in the old days, before we used infusion strips, before I was a cardiologist, they would measure how many drips would go into the IV before it would go into the body. And based on how many drops, the nurse would have to calculate how many milligrams a minute is going into the body. This is the old ways, and it's inaccurate. This way here, but the name of an infusion is a drip. And so he says on page 40 that he was on a drip. And then here, when he was describing what Dr. Adams was doing in page 54, he had his Diprovan drip going. And then on page 62, which was they were pertaining to the night of the occurrence of the arrest, Detective Martinez says, it is quick aside, it is something that has continually introduced to him as a drip, or is this something just a small injection? And Dr. Murray says you do a small injection to help him sleep, and then you try to drip slowly. And so I think based on his own testimony, Mr. Flanagan, Mr. Jackson was on a drip that night. And it makes logical sense because, you know, you don't see, that's just such a small dose that, you know, no one goes to sleep with such a small dose.
Right. Now, Dr. Murray never said he gave a drip that night, did he?
Yes, he did. He corrected the detective, dose and drip.
He was describing the dose that he gave. The detective asked him if he's given propofol before. He said yes, he's given it numerous times. The detective said more than 10 times, more than 30 times. Murray said he'd given him propofol with a drip for approximately 6-7 weeks, something like that. Correct?
Can I, yes.
Okay.
Just answer the question.
Yes, sir.
And he described how he did it. Correct?
He describes how he did it. He gives a bolus of 50 milligrams and starts a drip.
Right. And then, as of 3 days ago, he had changed his technique. And first of all, he gave, on Monday, he had given him 25 milligrams with a half a drip.
Half a drip.
Okay. On Tuesday, he'd given him no propofol.
Right?
And then on Wednesday, or that night, when he died, he'd only given him 25 milligrams infused over 3 to 5 minutes. Is that correct?
Yes, he gave
He
20.
never said he gave a drip.
I
that
disagree
night.
with you. He gave a drip. It says here. So you're saying that, let me repeat your question. Every single night for the last 2 months, he was giving 50 milligrams bolus and a drip every night of his powerful anesthetic agent.
Yes.
That 2 nights ago, he gave 25 milligrams and a drip, and that night he only gave 25 milligrams by itself. But am I right? So it's established, I just want to understand, it's established that every other night he gave a drip, all 2 months he was on a drip. And he was on a drip 2 days prior. But tonight he wasn't on a drip?
It doesn't say he was on half a dose and half the drip 2 days earlier. Correct?
Yeah.
And he slept all night.
He slept all night on the drip.
Yes. And then he was trying to get him off of the propofol. The following night, he gave him only lorazepam and midazolam. Did you see that?
Yes, sir.
And he indicated he thought he was really onto something, correct?
Yes, sir.
And then he comes down to the Wednesday night, he's trying to treat him the same way. He wants to give him lorazepam and midazolam only. Isn't that correct?
He wants to.
Okay. But then, between 10 and 10:30, Mr. Jackson, having not slept all night except for about 10 or 12 minutes, right around 3 o'clock, not having slept all night and being absolutely frustrated, told Dr. Murray that if he didn't give him any propofol, he wasn't going to be able to sleep, he couldn't do the tour, they'd have to cancel the show, and convinced Dr. Murray to give him some propofol right around 10:40 to 10:50.
Yes, sir.
Is that your understanding?
Yes, sir.
Okay, and then Dr. Murray, at that point in time, said he gave 25 milligrams over a period of about 3 to 5 minutes. And he never mentioned giving a drip, did he?
He did. He mentioned dose and drip, sir.
Well, maybe you could point it out to me.
Absolutely.
I'd like you to find a statement that he says where he gave a drip
Here.
that night.
I've given it to him before.
What page? What
I'm
line?
sorry. Let me, there's 2 pages. One,
What are you referencing? You're referencing a
I'm
transcript?
referencing his transcript, his testimony. And I
But it's
think-
not testimony, it's an interview?
Interview, yes, sir. His interview. And if you can,
Where are you referring to?
I'm referring, first of all, to page 39. Okay, first.
This is the same at this point. Now, you're referring to page 39?
Yes, sir.
What line?
Line 22, 21 and 22.
This is People's 198, I believe? Correct?
Yes,
Okay. Now, to put that in context, we've got to go up, starting at line 18, where he says, I've given it to him before. And then there's a comment by Mr. Chernoff, and he handled it fine. Dr. Murray says he handled it fine. Detective Smith, the same dose. Dr. Murray, the dose and the drip. Not the same dose in this case.
Right.
Because I had given him earlier, Versed, I'd given him the Ativan at different times during the night, and I know that their half-life is not as short as lorazepam. So I took a precaution, knowing that there was possible all of the medication still on board, so the 25 milligram ordinarily would not be a dose I would give him if he did not have those other agents on board. I would give him a higher dose. Then Detective Martinez says, okay, so it's a lower dose than normal? Dr. Murray, yeah. Now, where does he mention giving him a drip that night?
He asked him about that night on page 21, on line 21, the same dose, and Dr. Murray goes, the dose and the drip. Line 22, he says it. This is about that night. Same dose and drip, but not the same dose, meaning he usually gives 50. But this night, he doesn't give the same initial 50. He only gives 25. But he corrects Detective Smith. He goes, same dose? He could have said same dose. No, same dose and drip.
That was, I've given, line 18 says, I've given it to him before. They're talking about before, aren't they?
He handled it fine. He handled it fine, the same dose and drip. But they're referring to tonight because on this dose and drip, he goes, not the same dose in this case.
Well, let's go back, let's read. Line 18. I've given it to him before.
Wait, I think it's important, because we keep on referencing a transcript, that we
39.
have the speaker identified, please, because it's
Okay.
very tough on the reporter. Go ahead, please. Line 18, and you can identify the speaker, please.
Line 18, Dr. Murray. He says, I've given it to him before. Line 20, he says he handled it fine.
No, Mr. Chernoff says.
At line 20, Dr. Murray said he handled it fine. Correct? This is talking about before. Then there's a question. The same dose? Dr. Murray, the dose and the drip. He's handled the dose and the drip before, fine.
Objection. Counsel is testifying.
I'm sustaining the objection.
That's
Once
not
again,
a
the jurors will decide the evidence in this case.
The dose and the drip is referring to what he handled. Didn't you understand that to be referring to what he'd handled before, fine?
There's a bundle. No, I don't see it that way. I go, in this paragraph,